I often give iceberg analogy to my students and families as well. So just like as an iceberg, there is only small portion of that iceberg is visible, and there's a huge portion that is underneath the water. Many times I have noticed this, the children, teenagers, they come to me with a diagnosis of borderline personality disorder, bipolar disorder, anxiety disorder, depression, conduct disorder, intermittent explosive disorder. And when I sit with them, I try to understand, their life story from pregnancy till early childhood, how things have evolved, when the symptoms started, what might have contributed. And so try to explore all the underneath the factors. So what I have noticed, those labels, what I would say, were given to these children because the clinician, the mental health clinician, they were focusing only on the tip and unable to see so much underneath the water. And I have found many times untreated ADHD, trauma, autism, intellectual disability, learning disability may present in the clinic that may seem like an anxiety, depression, intermittent explosive, oppositional, borderline, bipolar, but underlying there is so much to explore that may be leading to what they are presenting now. And I often give this analogy, not every chest pain is a heart attack. Similarly, not every mood swing is a bipolar disorder. Not every self-cutting behavior or, or the substance use or, the changing in personality is a borderline personality disorder. Not everyone who say I'm feeling sad or I have suicidal ideation is going through a major depressive disorder. So as a clinician, it's very important for us to not only understand the tip, but also put enough efforts to understand what are the factors that may be making this child vulnerable to present this way.